Hi, I'm Dr. Colin Ross, and I'm the Executive Medical Director of Trauma Programs at 3 different hospitals: Timberlawn Hospital in Dallas, Texas, Forest View Hospital, which is in Grand Rapids, Michigan, and Del Almo Hospital, which is in Torrance, California. The majority of people who come into our trauma programs are either self-mutilating or acutely suicidal or really unstable and unable to care for themselves and maintain basic safety. And the principles that we use in the 3 programs are really the basic Ross Institute philosophy that's explained in the trauma model book, in various other publications, and in all the workshops that we do. And what we're going to do now is a role play. Melissa Caldwell, who's the executive clinical director of the programs, who helps in program design, philosophy, supervision, and oversight, she's going to role play a woman who has been self-mutilating a great deal recently and also has a great deal of self-blame. Now, you're going to hear some general principles that we use in the program all the time, but I want you to bear in mind this is a role play. It's not an exact copy of therapy. It's not really identical, but it illustrates the basic principles of therapy. And the things that you're going to hear and that I want you to listen for are also explained in the trauma model book. Number 1 is the locus of control shift, which I'll teach the client in the consultation session. You'll hear the problem is not the problem. That is, the presenting problem is always the solution to some other problem in life. The attachment to the perpetrator is really one of the core fundamental elements of the program, and there'll be a great deal of that repeated here and there throughout the session. There's the addictions component of the model, that you just have to say no to drugs, whichever particular addiction you have. And the idea is that all these addictions serve a fundamental function of avoidance of feelings and conflicts. So it's all about avoiding your basic feelings and conflicts. And then you'll hear me explain several different pathways to self-mutilation, which include reinforcement of the locus of control shift and mood state regulation, making those bad feelings go away, creating an illusion of power, control, and mastery, and having this warm flood of good feelings, positive control. And then I'll make a couple of comments at the end of the role play just to remind you about what you've listened to. So you're comfy there? You've got a chair?
Yeah, this office is kind of hard to find.
Yeah, it's a little bit out of the way. So
How long is this going to take?
probably right around about an hour, roughly. We might go over a little if we need to.
Okay.
And so as you know, I'm Dr. Ross, and your therapist has asked me to do this consult, spend some time with you. The purpose of it, as I understand it, is just get a second opinion. I'm going to ask you a bunch of questions, see if I can help figure out where to go in treatment. And your therapist has asked the focus to be on the self-mutilation that you've been doing recently, that I understand has gotten worse recently.
I told him it's no big deal, but he's concerned about it.
Is there anything else about the purpose of the hour that you have in your mind? Does that kind of cover it?
Well, yeah, I mean, just I guess for just some direction, because things do seem to be getting worse, but the self-mutilation, I don't worry about that. He does.
Right. So from your perspective, the self-mutilation is not a problem.
Not the biggest problem, no.
Okay. What is the biggest problem?
I need to be able to get my life together so I can go to school and finish my degree and be productive. I just want to be able to finish something I start.
And you don't see the self-mutilation as interfering with that goal in any way?
I mean, I'm sure it doesn't help, but my main focus is graduating from college.
Okay. And I read some of the records your therapist sent. Now, that's your master's degree you're working on, I think, right?
Yeah,
And what's it in again?
psychology.
Oh, yeah. And then what would you plan on from there?
I don't know, maybe be a counselor.
Are you thinking about possibility of a PhD?
I've thought about it.
So either a master's level counselor or a PhD level counselor is what you're thinking.
Yeah.
And how far through your master's are you?
I have 2 semesters left, but I have some incompletes that I have to finish, and I keep getting them extended, and I can't do it much more.
Okay, so we've got one general goal in life clearly identified, which is to finish your master's and maybe go on to finish your PhD, but get into the counseling field.
Well, I have to have at least a master's to do any kind of counseling.
Right, I understand that. Do you have additional life goals? Like what about relationships or hobbies or travel?
Well, I had one. I mean, I'd like to get married someday.
Interested in having kids, have a family?
Yeah.
Okay, so you have work, which would be the counseling field. Then you have relationships, family, kids. Those would be your 2 major life goals.
Yeah, but I want to be able to have a job first.
Right. Okay. So step 1 is get the degree finished. Step 2 is job. Down the road, relationship and family.
Right.
Okay. And right now, I assume if I talk to your therapist would agree that those are sensible goals, and he's on board with you, and you're working together towards those goals,
Yeah.
right? But your therapist is more focused right now on the self-mutilation as being a big stumbling block.
I know he
Okay.
is.
What I want to do first is understand from your perspective why you do that. Why do you self-mutilate?
I need to. I mean, I've explained this to him.
I just want you to give me a kind of capsule summary so I've got it straight from you. What's the main purpose of the self-mutilation?
It just makes me feel better.
So before you self-mutilate, it doesn't take long to figure out you're feeling pretty rough.
Well, yeah.
And what does rough consist of? Can you describe the feelings a bit? What kind of feelings?
Overwhelmed, scared, frustrated, anxious, just a bunch of stuff.
And then when you self-mutilate, do those feelings go away pretty quick?
Yeah, instantly.
Instantly? And what comes to take their place?
What do you mean?
Well, all those
They
bad
just go away.
feelings go away.
Yeah.
Then what feeling is left behind, or what feeling do you have from there on?
Well, I mean, I feel better.
Would you say that you feel just kind of neutral, okay, or do you get kind of a warm rush, feeling good, kind of a glow, high, positive
Yeah, it's kind
feeling?
of like a high.
Right. And do you have a sense
I mean,
of
he keeps saying it's addictive, but I mean, it is like a high.
what
It
does
makes
he?
me feel better.
What do you think he means by that it's addictive?
I think he says it's addictive because I don't stop, but it does make me feel. It makes me feel a lot better, and depending on how deep I cut, sometimes it makes me feel even more better.
I want to remember addictive and come back to it in a bit. But what I want to do is understand a little bit better the function of the self-mutilation and also how often you've been doing it. When was the
depends.
first time in your life?
Oh, I always would like scratch my arms and stuff in school.
School being elementary, junior high?
Junior
Middle
high. And I would scratch them and stuff till they get really red, and it wouldn't hurt. It's like a rug burn. You know how when you kind of take off the top layer of your skin, and I could scratch them with my hands or rub my clothes against my arm when I'm in class. And at first I remember it would burn, but then it got where it didn't hurt. It made me feel better instead of hurting. I wouldn't stop.
Okay, and when did you first start cutting yourself?
In high school.
And are you 28 now, is it?
Yes.
28. So we're talking about 10 plus years, somewhere between 10 and 15.
Yeah.
Okay. And when did it get a lot more frequent recently? How long has that been?
Probably in the last 3 months. I cut a lot more, and I've had to go to the emergency room more, and they're getting deeper, and he's worried about me really doing some damage, but I mean, I know when to stop. I know how far to cut. I keep telling him it's not that big a deal.
Okay. Just so I've got the right idea, roughly how many times would you have gone through your skin in the last 3 months?
Oh, I don't know.
Just ballpark rough.
In the last month?
Well, give me last month and last 3 months.
I probably cut a couple times a week.
For the last month.
Yeah.
And how about the 2 months before that?
I've probably cut 2 or 3 times a week for the last 3 months.
Oh, okay. So that's quite a lot. And how many times have you been to
Well,
the
the
ER?
the last time I had to get a lot of stitches, and that's what really... Well, it wasn't a lot. He said it was a lot. I had 12 stitches in my arm. I had 3 different cuts, and I got 12 stitches.
Right. Is that in the whole last 3 months, is that the only time you've required stitches?
No, but
How many
not that many.
So roughly how many times have you required stitches?
One other time.
Okay.
And he's afraid I'm going to keep doing it or something and make it worse and have to get more and more. I know how to stop. I know where to stop. I won't hurt myself.
Okay, so you're telling me that this behavior is under your control. It's something that you choose to do, and you don't see it as a problem.
I mean, you have to pick up a razor blade.
Right. Well, clearly, there's a whole series of steps that you have to do. You have to think of it. Then you got to hop in the car, make sure you got your purse, got enough money, get to the store, buy the razor blades, bring them home, store them
I just
somewhere.
usually buy a whole bunch and leave them at the house. I just have to know they're there.
But all I'm saying is there's a series of steps and there's
Yes.
a series of choices and decisions that you make.
Yes.
So it's clearly not just impromptu out of nowhere behavior. It's planned.
I know when I need to cut.
Right,
Yes.
exactly. So I'm in agreement with you. This is not an out of control behavior.
Have you ever worked with people before that cut?
Quite a lot, actually.
Have you ever done it?
the answer is no, that I haven't, but why would it be important to know that?
Because I don't know why I'm coming to you if you're a specialist. You're supposed to do a consultation for my therapist. You've never even done it.
Well, the answer I always give to that is I went to medical school, so I have an MD, so I'm a medical doctor, and then I specialized in psychiatry. If a medical doctor had to have every disease he treated, all the doctors would be dead and there'd be nobody left. So you can't possibly have all the problems or diseases that you treat. It's just not statistically possible. It's not practical or realistic. And a surgeon can treat a brain tumor when he himself has not had a brain tumor.
Yeah, but how are you supposed to know how to help me stop if you don't understand it?
Well, how about if we put that question on hold for a bit, and then when we get nearer the end of the hour, let's review it and see whether it looks like I do understand anything or I've helped you understand anything. And it does seem I know what I'm talking about, and let's see if it seems like it was helpful. Is that fair enough?
Yeah, that's fair.
Because it's a very reasonable question. So, just to review, what I understand from you so far is that this is behavior that is planned, it's careful, it's deliberate, it's under your control, you choose to do it, you know why you do it, and it serves a specific purpose, which is it gets rid of the bad feelings. It brings kind of a rush of good, positive feelings. I assume some kind of sense of power and control. You're on top of your problems. You've got the bad feelings under control.
I mean, yeah, it's about controlling things. I know that because I.
So since it is true that it's planned, it's conscious, it's deliberate, it's under your control.
I know. I can plan to choose to not do it, is what you're going to say.
Well, hypothetically. So what I want to do is just run through a hypothetical. And this is purely hypothetical. If you were to stop self-mutilating, just stop right now and not do it for, say, 6 months, what would happen?
I wouldn't choose to stop doing it. It works.
Well, that's why I'm saying it's a hypothetical.
Why would I want to stop if it helps me?
Well, you wouldn't. That's why you haven't. But what I'm trying to do is understand better the function of the self-mutilation. Because there's a sort of principle of therapy that I use all the time, which is the problem is not the problem. And I teach that in workshops. It's in some of the books that I've written. And basically the idea is when somebody presents to me with, say, the problem is drinking, or the problem is depression, or the problem is flashbacks from trauma. In your case, the problem, quotes, is self-mutilation. But actually the problem, in fact, is a solution to some other problem. And you've explained that to me already. Self-mutilation isn't the problem. It's the solution to the problem of overwhelming bad feelings that you haven't got another way to control.
So why are we focusing on the cutting if the cutting's not really the problem?
Well, I'm trying to get off the cutting. That's why I'm going into this hypothetical. Hypothetically, it's just put the cutting way over on the other side of the universe. It stopped. Now, what would the problem be?
What would the problem be?
Yeah, if you weren't self-mutilating.
The problem would be I'd need to self-mutilate and I can't.
Yeah, I know, but what would start happening? How would you feel?
I've already told you. I would feel I'd be overwhelmed, uncomfortable, scared, frustrated.
Right.
I don't know. I'd.
But then if you didn't self-mutilate to shut those feelings off, where would you go next? What would happen?
It'd be too much for me to handle.
And if it was too much for you to handle, then what?
I don't know. I've never gone there.
What are you afraid might happen?
I would lose it.
And if you were to lose it, what would that look like? What would it consist of? Just how do you imagine it is what I'm asking.
I think I would I just couldn't handle it. I couldn't handle it physically or emotionally or mentally.
Well, let me make some stupid examples just to make the point. Would you melt into a puddle? Would you blow up into a million places?
I'd lose my mind.
Where would your mind go?
Well, what do you think people mean when they say they lose their mind?
I'm not quite
I'd
sure.
go crazy.
And so would you then be admitted to a mental hospital for the rest of your life?
Probably.
So you'd be like staring at the wall, just gone for the rest of your life?
I don't know, maybe.
But what you fear is something gigantic, horrible, long-lasting.
That I can't get out of, yeah.
Right. So if that was actually true, if that was factually true, your options are self-mutilate or don't do anything, feel the feelings, end up gone and staring at the wall in the mental hospital for 20 years. Right. If that was actually true, that it was too much, and the result was you would be staring at the wall in the mental hospital for 20 years, absolutely the most sensible thing to do is self-mutilate.
So you agree it's okay to do?
No, I don't. And here's why. My goal, my job is to try and find some other actually working, useful, functioning options for you besides self-mutilation. Now, I can't just find that in 5 seconds. But in theory, the idea is if we could figure out some other methods to deal with, to control how you're feeling, to dampen it down, to make it tolerable, and they worked, then that would open up the option of not having to self-mutilate, maybe. Just in theory. Would that make sense?
Well, yeah, but I mean, I've tried all. There's a list I'm sure in the notes he gave you of all the different kind of medications I've been on. It doesn't work, and I don't like them because it doesn't do the same thing.
There's always a faint chance some medication would help, but let's just scratch medication off the list for now. Maybe come back to it later. So we won't consider medication as one of the
Well, what else
options.
is there?
Well, let's get into that, but there's a few other things I want to find out about first. So the motivation or the purpose of the self-mutilation that you described, the jargon term I use for that is mood state regulation. So it has a very clear purpose. It's to regulate your mood state. That is, to take the bad feelings away. Not 100% of the time, but very often there's another purpose for the self-mutilation, which is tagged right in there, which is punishment of yourself. Proving to yourself that you're a bad person, reinforcing that you're a bad person.
Why would I want to do that?
Well, I don't know to start with that you are doing that. How do you feel about yourself just before and while you're self-mutilating? Are you feeling kindly and happy about yourself?
I don't think about that. I just think about I'm overwhelmed, I'm frustrated, and I need to do something to stop it.
So from your
I don't like do a self-esteem checklist or anything here.
Okay. Well, that's good because that would be an odd thing to be doing at that moment in time. So your experience is that basically your attitude towards yourself is kind of kind and helpful. You're trying to take care of the problem.
You just said
The
yourself it's a
feels.
solution to a problem. So yes, I'm helping myself out.
Okay. Now I'm going on another hypothetical here, if you can tolerate it. The additional hypothetical is you and I are both police officers, and we're cruising around in our squad car, and we're called out on a domestic violence call. We get to the house. There's a woman who's like 5'2". She maybe weighs like 106 pounds. And there's this guy who's 6'3". He weighs 220 pounds. He's drunk. He's really mad. He's throwing stuff around. She's got bruises. She's bleeding. I'm not sure exactly why. He's got some kind of sharp object in his hand. Looks like a knife. When you walk into that scene with me, are you going to say, this is a very kind gentleman. He's obviously helping his wife manage her bad feelings.
Well, that is stupid.
It's obviously totally stupid, right? And he's not going to be sitting there with a smile on his face or like trying to imitate some Eastern guru or something. He's going to be out of control. He's going to be mad. He's going to be hostile. There's going to be big energy. And we're going to be kind of watching what's going on here because we might be involved in a takedown here, right? Would you agree?
Yeah.
Okay.
Well, there's a knife in his hand.
Well, sure. So obviously the feeling that's driving his behavior is anger. His attitude is hostility. And the behavior is violent. And it's hostile and destructive towards another human being.
Right.
And it's actually a crime. And we're going to try and stop the behavior because it's wrong.
I know where you're going with
Take him
this.
away. Where am I going?
But it's different.
Okay, first tell me where I'm going.
Well, you're trying to apply this to me, and it's not the same because it's not okay to cut other people. It's not okay to hurt other people.
Okay, but it's okay for you to hurt you.
Well, they don't deserve it.
But you do.
Well, that's for me to decide.
That's true. Explain to me why it's true that you deserve to be cut.
Because it makes me feel better.
But what's that got to do with deserving it? You said it's not okay to mutilate other people because they don't deserve it.
Right.
I do. What makes you different? What is it that's different about you?
Sometimes you just know, and I just know.
And what is it that you just know?
I've done a lot of bad things. You don't know me.
That's why I'm asking these questions, to get to know you just a little bit, to see if I can help out in any way. It's true that I don't know you. Otherwise, I would
for
already...
starters, when you have a dad telling you you're stupid all of your life and yelling at you, that might have something to do with it, you think, Doctor?
Yeah, I do think. Clearly it would. So you grew up in an environment where you got lots of negative feedback about yourself from your dad. You're no good, you're bad, you're this, you're that, you're a failure.
And he blamed me when my mother died.
I think I read in the chart you were 8?
Yes?
Your mom died in a car wreck, right?
Yes. And just ask my dad whose fault it is. He'll tell you.
Okay, he's not here, but I'm going to ask you in a minute. But first, I'd like to know, tell me about that day. What was going on? When was the last time you saw your mom?
When I was 8 and she was dropping me off at school, and we were arguing because I wanted to go to camp that summer, and she said we couldn't afford it.
Right. So how did you feel?
I was angry at her.
What did you think about her? Did you think to say something to yourself?
Why did you ask me that?
Well, because it's just a natural question. I'm wondering, you were angry at your mom. You were angry because she was saying that about summer camp. So then the natural next step would be you'd be thinking an angry thought
I told her
about your
I
mom.
hated her and I wished that she would die.
Out loud or inside your head?
In my head.
Okay.
And she died. She
Right.
didn't get home that day. She had a car wreck. It killed her while I was in school. I killed my mother.
How did you kill your mom? By thinking an angry thought about her?
I wished that she would die, and she did.
Okay.
Who else's fault is it?
Well, according to your view of the world, there's nobody else. It's got to be you. You're the only candidate. It has to be your fault. That's what
I was
you're
the
telling me?
last person to see her.
Right. Okay. And then what did your dad tell you about that? You said that he told you it was your fault. Like afterwards, right?
He said I had her so upset because he asked me the same thing when I came home. What happened today? He told me that she was in the hospital. He didn't tell me she was dead. And I told him that I got in a fight with her, and he said that I probably upset her so much that she couldn't concentrate and she had a wreck.
Okay. And that was typical of the blaming and hateful statements he made towards you before that and after that.
Yeah,
for
it got
years.
worse after she died.
Okay. I want to explain something to you that's an idea that I have that, like, I always have some sort of a jargon term to describe my ideas just so.
All doctors do.
Right. So here I am a doctor, so I have a jargon term. And the term that I invented is the locus of control shift. Now, here's what I mean by that.
English.
That's what I'm going to do, translate it into English. The basic idea is that we know just from common sense and being around kids, and we know from Piaget and developmental psychology, all that stuff you studied as an undergrad. We know that kids don't think like grown-ups. Kids think like kids, which is, and I'm talking about little people, kind of this tall, 3, 4, 5, 6-year-olds, even 7 or 8. Kids think in a way that's self-centered. They're at the center of the world. Everything revolves around them, and they're the cause of everything that happens in their world.
That's called being egocentric.
It's called being a normal kid. It's called a developmental stage of normal child development. It's childhood cognition. Remember Piaget. These are not dumb kids. These are normal kids. This is all kids. Think in this way. I'm at the center of the world. Everything revolves around me. I cause everything that happens in my world. And I have this magical power to cause things in a way that isn't actually real from an adult perspective. So the example I always use when I'm explaining it at workshops or wherever is, let's imagine a family that's fairly stable and normal. There's a 4-year-old girl. All of a sudden, parents split up, dad moves out. What does that little girl feel like? Of course she feels sad, lonely, overwhelmed, powerless, helpless, trapped. It's a very upsetting and overwhelming experience. And she walks around thinking to herself, why is this happening? And she comes up with a theory. I know why Daddy doesn't live here anymore. It's because I didn't keep my bedroom tidy. Now that's totally inaccurate, unrealistic, not true, and we know from an adult perspective that it just isn't reality. But from the perspective of the little magical child, it is absolutely, for sure, totally the truth. Daddy doesn't live here anymore because I didn't keep my bedroom tidy. That makes it the little girl's fault. So she completely buys that she caused it, it's her fault, she's to blame. But the good thing is, she's now got a solution, because all I have to do is tidy up my room and Dad'll move back in. So because she has a solution, she doesn't feel overwhelmed, powerless, helpless, trapped. She's not so lost, lonely, sad, because she's going to fix things tomorrow or the day after, and everything will be okay again. So it's an illusion of power and control over the situation, which actually creates a buffer. It's developmentally protective. She's able to feel she's got some power, some autonomy, some mastery, some control. She's got hope for the future. She's got a plan of action that will work. In order to have that illusion of power and control and mastery, she's got to be bad. It's got to be her fault. So the belief that you're bad is tagged on to the illusion that you have the ability to fix the situation. And this is something that we see all the time, not just in children, but in grown-ups.
My mother never even had one traffic violation. She never had one ticket.
Right.
She's very conscientious. She was very conscientious when she would drive. She always used her signal. She ran through a red light. That's not my mom. I mean, that's not her. What other reason could it be unless it was that I had her so upset with what I said that she did it?
What time did she drop you off at school?
I don't remember. 8 o'clock, I guess?
Well, around 8 o'clock. What time was the accident, do you know?
Like 10 after 8. It was on her way home.
Oh, so it was immediately after. Okay.
So
Well,
see?
I can see how it would look that way to the magical 8-year-old child very easily. And let me explain how it's not just children. If, let's say, somebody 24 or 28, your age, is walking in the park one day, all of a sudden a stranger jumps out of the bushes, sexually assaults her. It's absolutely at random. It's not poor judgment or risk-taking behavior or bad decision to be in the park in the middle of the afternoon. She's been there 100 times before. There's no way she could have predicted it. There's nothing she could have done to prevent it. She's going to start thinking stuff like, I should have known better than to walk in the park. I should have had my cell phone on. I shouldn't have been wearing those clothes. She's going to come up with a million reasons why she was dumb, why if she'd been more vigilant, if she'd been smarter, more cautious, seen the signs, she could have prevented it. That's afterwards, after the assault has happened. She's looking back in time to the moment of the assault. And she's doing magical child thinking. I had the power. I should have been able to psychically or clairvoyant or feeling the vibes or noticing what color the leaves were. There should have been some clue somewhere I could pick up on. Actually, in fact, there was absolutely no way to know
Don't you
or
think?
predict.
Don't you think that so that she feels like there's something she can do to prevent it from happening again?
Absolutely. 100%. I'm with you 100%. And that's exactly the point. It's magical thinking to maintain an illusion of power and control to try and prevent bad things from happening in the future.
So you're saying if you believe that you're bad, it's a way to get some kind of control over a situation where you're saying you didn't have any.
If you rob a bank and shoot a teller, then believing you're bad is accurate. It's a very bad thing to do. But I'm not talking about believing that you have done a bad behavior.
I wish that she would die. That's a bad thing to do.
Actually, I'd just say that's a normal, mild temper tantrum thought for a kid to have. But you're not telling me that you did one bad behavior once and you deserved a 2-hour timeout. You're telling me that you're absolutely bad right to the core, permanently, end of discussion for all time. And what I'm saying is that's the locus control shift. That you've shifted the actual control, which is outside you.
I can't even look in the mirror sometimes. I'm so angry at myself. Sometimes
Right.
I'm so disgusted with what I see, I can't even look in a mirror.
But if we start with the assumption that you're starting with, that you are such a horrible, bad person that you recklessly, out of bad character and spite, caused your mother's death, how should we feel about you?
But look at all...
Good? Should we feel good about a person who on purpose recklessly causes the death of their mother? No. It'd be just like you were 19 and you shot your mother because you're mad at her because she wouldn't lend you $100. We're not going to feel good about a person who does that, right?
Right.
So if it is true that you caused your mother's death, of course you're going to be mad at yourself. From my perspective, though, the whole crux of it is that really, in fact, realistically true? Is it possible that an 8-year-old child has got the power to so disturb her mother that she causes a traffic accident and it's 100% the child's fault? Is that a realistic thing to think about any 8-year-old child?
Well, I can't imagine why else my mother would have ran a red light. And that's not the only thing. I mean, all of my life, there's bad things that happen all the time. There's stuff that happens all the time. And why would all of these things happen over and over to someone unless they were bad? This is not the only thing that I've done that proves that I'm a bad person.
Okay, and you may actually have done some, quotes, bad things that nobody would feel proud of. But I'm not there yet. I'm just on this one major thing that happened that really nailed down the locus of control shift. So I want to try and do another hypothetical with you. I notice that you're holding on to the belief that you're bad very, very, very tight.
Because it's been shown to be true over and over and over. I just gave you one example.
Right, but I want to just stay in that one example for a second. You're just not budging. There's no way you're going to budge. So I can see that you're holding on very, very, very tight. There's no other possible explanation. I killed my mom, that's it. And if that's true, it's not surprising that you're angry at yourself and you're punishing yourself. Because what would be a fitting crime for murder? It would be basically capital punishment, right? So you haven't actually killed yourself, which would be execution, but you've punished and punished and punished. You've got yourself sentenced to a very long prison term for the crime of killing your mom.
I don't deserve good things. I don't deserve... Would that be why I get upset when people compliment me? Or say something that I did a good job? I hate that.
Well, how does it make you feel when people compliment you?
It makes me angry. And I feel like that it's a lie and they don't know me. And if they really knew who I was, they wouldn't be saying that.
But why do you get so angry about it? Why don't you just go, well, there's an idiot who doesn't know the truth?
Well, sometimes I do.
But when you really get mad about it, what is it that's driving that?
That they don't know me. And that...
So? That could just be a fact. When you're really boiling mad about it, what's going on?
Well,
Why are you so
I know
angry?
you're making it worse than it is. I don't say I'm boiling mad. It just makes me mad because it's not true.
Okay, well, not boiling mad, but pretty mad.
I don't know if it's pretty mad or what. It's not true.
Okay. So what I'm thinking is, the fight-flight response you see on like Animal Planet and Discovery Channel where an animal's cornered? It's either going to flee, which is run away, or it's going to fight, right?
Right.
So when you get angry like that, I think your adrenaline's up and going, you're feeling attacked, and you're in counterattack mode, and you're angry, and you're ready to go for the jugular sort of thing. So that tells me that you're perceiving some kind of threat. And to me, I'm just working on a theory here. I don't know that this is true for sure. My theory is that the threat is a little bit, there might be a reversal of that locus of control shift. If somebody compliments you, and 5 people compliment you, and somebody gives you a huge compliment, and somebody treats you nicely, that's going to start adding up to a big pile of evidence that maybe you're not fundamentally bad and unlovable. And if that really sinks in, and you really buy that, not number 1 in your head, step number 1 in your head, step number 2 in your heart, so it really sinks in, and you really know it, and you really believe it. You are not bad, you never were bad, you never caused your mom's death, it was a horrible accident. If that really sinks in, then you're going to lose that illusion of power and control that you had over many situations in your life. Right now we're just focused on your mom's death. And if you really, really get it in your heart, all the way down to your toes, that you didn't cause it, you didn't deserve it, what's going to happen? All those unresolved feelings are going to come up and flood you, and you're going to feel all the sadness, all the loss. You're going to feel what was true in the situation: powerless, helpless, overwhelmed. Your mom has left you, and now you're stuck with your dad, who's not a very nice dad.
I'm not mad at my mom for leaving me. It's not her fault.
It's not her fault, but you've made it your fault in order for it not to be her fault.
Well, so I don't know that that's true, but my mom was wonderful. I mean, we would play, we would cook, we would make pie together. I mean, she would teach me stuff in the kitchen. I was with her all the time in the kitchen. I mean, we did stuff together all the time.
So you're very lucky that you had those 8 years. That's more than some people get. But I want you to go into another hypothetical with me.
I'm not very lucky. I'd be lucky if she's with me now.
Then you'd be very, very lucky. But 8 years is better than nothing. A lot of people don't get that in life.
That feels really minimizing.
I'm not trying to minimize it. I'm trying to balance it a little bit. It's just factual. You underwent a horrible tragedy and loss when you were 8 years old, and it devastated you, and it's clearly still affecting your thinking and your feeling and your behavior. It's an unresolved, major tragedy. There's nothing much bigger than losing your mom when you're 8 years old. All I'm trying to do is balance that against, you didn't have 0. You had 8 years of a wonderful foundation. I think 0 would have
been better, because then it wouldn't hurt so bad to know what I've missed.
That could be true in a way, but the balance against that is, because you had 8 years and you had that foundation and you had that love, look at who you are. You've got, I'm sure, many positive traits. You've accomplished quite a lot in life. You're almost finished your master's. you must have gotten a lot from your mom that turned into important building blocks for life that you wouldn't have had if she died when you were 0.
She was absolutely wonderful. There was not any. My mother was the most loving person.
Right. So if it wasn't, here's the hypothetical again. If it wasn't, never was, absolutely never was your fault, whose fault would it be then?
That's what I'm saying.
In the hypothetical, though, if it wasn't your fault, then what would you be left with? Whose fault would it be?
I don't know, because nothing else makes sense.
Could it be your mom's fault?
No, my mom was a great driver.
Your dad's fault?
Well, it can be his fault. That's fine.
Yeah, well, I know, but because you're mad at him. But just realistically, is there some way it could be his fault?
He wasn't the last person that talked to her.
Okay.
They didn't fight that morning.
So if it wasn't your fault...
He didn't wish that she would die.
Well, he didn't treat her with a lot of respect, I would imagine.
Well, he got a lot worse after she died, too.
Right, I'll bet. But coming back to this hypothetical again, if it wasn't your fault, maybe it could just not be anybody's fault. Why couldn't it just be...
Well, then why did it happen? Why was I left with my father? Why did the most beautiful person in my life leave me with my father?
Maybe that's a question that just doesn't have an answer.
Well, that can't be.
Why not?
Because there needs to be an answer. You have no idea what I went through living with my father. For nothing?
Why would it be for nothing?
Because what's the reason? Why? I don't understand why someone like my mother, who is as beautiful and as good a person as she is, would die and leave me with someone like my father.
Now, I'm going to exaggerate a little bit here, but I thought I caught a little tone of anger at your mom. I don't understand why somebody like my mom would die and leave me.
I'm not angry at my mother.
I thought there was a little hint in your tone of voice there.
You were wrong.
Okay.
Which I'm sure is not the first time.
No, I've been wrong many times, and I'll be wrong many times in the future.
I'm not angry at my mother.
Okay. Here's why I'm thinking that's a little unbelievable. Because your mom left you by dying. That's a fact, right? Looking at that fact from the perspective of this magical child, another line of thinking that any normal kid's going to go through is, Mom is so big and so strong and so powerful, she must have decided to leave me. She must not have loved me that much. She must have wanted to get rid of me.
I never thought that about my mother. I know my mother loved me.
Right. I'm just saying this is a line of thinking that I would expect most kids to have going on somewhere in their minds. There'd be some anger and resentment at mom, especially if mom leaves you.
So like being mad at my mom for dying.
I'd say that would be a totally normal reaction for any kid to have.
You cannot be mad at someone for dying. I mean, you can't be mad at someone who's dead.
Why not?
What? That's terrible.
You can't be angry at somebody who's dead. So nobody's angry at Adolf Hitler? He's dead.
Well, he was a bad person. My mother wasn't.
Okay, so you can be angry at somebody if they're dead, if they deserve that anger.
Yes.
Okay, so it's possible to be angry at somebody if they're dead.
Yes.
So what I'm saying
is... But they
is...
have to be you have to have reason, and he was a bad person.
And now we're talking from our grown-up adult minds. We have lots of reasons to be angry at Adolf Hitler. Nobody's got to go into an explanation about it. So we all dislike him, we dishonor him, we don't respect him. He's the most evil guy in the 20th century, right? From our grown-up adult perspective, we've got a whole long list.
Well, he was pretty bad, yeah.
Absolutely. It's absolutely true that he was a very evil person, and we all know that, and we agree with that. So from our adult perspective, we've got a long list of very legitimate, accurate reasons why we were angry at Adolf Hitler, and we're very free to say that, even though he's dead, right?
Right.
What I'm saying is, let's go back in time to the 4, 5, 6, 7, 8-year-old child, that magical self-centered thinking. From the perspective of that child, even though it's not true from an adult perspective, from the perspective of that child, there's a lot of reasons to be angry at mom for leaving me, because mom's got all that power and all that control, and she must have decided. Those aren't realistic grown-up reasons.
Look what happened last time I got angry at my mom. I don't think I can afford to get angry at people anymore when they die.
What might happen if you get angry at your mom now?
It would hurt her.
What's your belief about that? Is she watching from heaven and listening to this conversation right now?
I don't know for sure, but I would like to believe so, yes.
But if she is, you don't want to say something that would hurt her feelings.
Exactly.
Okay. That's very kind of you. And that's clearly based on loving your mom a lot. Before your mom died, ever once in your life did you ever have a temper tantrum or get mad and express anger at her?
I don't remember. I just remember the one time I did and she died.
That was when you were 8. But it's a pretty safe bet that sometime from age 0 to 8, you got mad at your mom and said, Mom, I hate you. Or,
Why
Mom,
are you wanting me to hate my mom? Why are you wanting me to get angry at her? I mean, I'm getting angry at you because you're wanting me to get angry at my mom. She's all that I have. She's all that I had.
Right.
I'm not going to be angry at her or hate her.
This is not Dr. Ross's school for hating your mom. I'm not trying to brainwash you into hating your mom. That's not the
I hate
idea.
my father. Isn't that enough?
Here's the problem. I think that, and this is just a theory I'm working on. I don't know any of this for a fact. I think that your self-mutilation, to a large extent, is driven by very angry, unresolved feelings that you're directing on yourself. And what I'm thinking is some of that anger could be unresolved anger at your mom. And the reason I'm thinking that is exactly what I've been saying. It seems to me that any kid who's overwhelmed like that, somewhere in the mix of all those overwhelming feelings, is going to be mad at mom for leaving. Mom, why did you leave me? I hate you for leaving me. I think that's a totally normal child reaction. Therefore, I think it's unlikely that you had 0 of those feelings. What I'm going back to is now, you've told me that you can't have those feelings because your mom's all you got. And if it is true she's listening from heaven right now, it's going to hurt her feelings and drive her away, and you might lose her permanently. So what I'm doing is going back in time now before she died, and I'm saying it just common sense tells us you must have expressed anger at your mom or had a temper tantrum a few times. You couldn't be the world's...
I think all kids probably do.
Right, so you couldn't possibly be the world's only perfect kid who never got angry at their mom.
But what does that have to do with me now? Why are we talking about this?
Here's what it's got to do with you now. I think it is true that you got very angry at your mom sometime in your life, and she didn't stop loving you.
Yeah?
I think it's true that if your mom was alive now, and she didn't like something you were doing, you could get mad at her, yell at her, storm out, slam the door, and she wouldn't stop loving you.
We're talking about my mom, not my dad.
Your mom.
Yeah.
So therefore, it's probably true that you could get angry at your mom right now, get mad at her for...
It makes me sad to think
Sure
about
does.
getting angry at my mom.
Of course it does. It's incredibly sad.
Why does it make me sad? I don't want to be sad about being angry at my mom.
Because there's a couple of steps to it. If you're angry at your mom, and you allow yourself to feel that anger at your mom, which is not weird, which is not bad, it's not a sign of mental illness or misbehaving child, it's a totally normal child feeling to have. If you are angry at your mom, and you really, really feel that, and you really know that, then you're getting in touch with how you really felt at the time, and how you still feel right up to the present. When you get in touch with that feeling, it's a very small step from, Mom, I'm angry at you, I really hate the fact that you left me. It's a very small step from there to all the sadness and all the loss. So if you can stay away from the anger, you're staying away from the loss and the sadness.
My counselor said he doesn't think I ever grieved. In school, after she died, I'd go see the counselor. They said they didn't ever feel like that I really grieved. Is this what you're talking about?
That's exactly what I'm talking about. And so you've done a couple things with your anger. You've done the locus of control shift to blame yourself. Okay, it's not really that bad because after all, I deserved it. I caused it. I'm just a brat.
That feels better. That's actually
feels
easier.
better. Right, that's easier. Exactly my point. That's easier. Then you can take all that anger at mom. You don't want to get angry at mom because you might double lose her because you're driving away the mom in heaven, and you don't have a right to be angry at the dead. So what are you going to do with that anger?
And it also feels like there was nothing good in my childhood at all.
That could very well be an accurate description after your mom died. From what I read and from what your therapist told me, there wasn't a whole lot good for a lot of years. So therefore, you're going to be wanting to hold on to the good of your mom even tighter, right?
Right.
Even more, you're not going to want to lose her. And if you believe, again, we're in the magical child, normal childhood thinking. If you believe that it's bad to be angry at the dead, You don't have a right to be angry at the dead. You don't even have a right to be angry because it's your fault your mother died, because you caused it. And you can't afford to get angry because that'll drive her away further. There's just no way you're going to allow yourself to feel that anger. And like I said, if you feel the anger, then you're just one step away from all that sadness and grief and loss. So you're not going there. So what do you do with that anger? You turn it on yourself.
That's how I feel right now is how I feel when I want to cut myself.
And how is it you feel right now?
I just feel extremely sad.
Right. And
I almost feel like that little girl scared again, too.
Right. I'm sure it was an unbelievably scary and overwhelming
Well, this is when I want to cut. So this consultation isn't working very well because I want to cut more now than I did before I came to see you.
Okay, but we're going to work on that starting right now. So part of the thing is to understand what's going on. Just have a map of what's going on and make sense of it. And what I'm saying is the final little tie-in here is when you take that anger and you direct it on yourself, you're like, remember the analogy of where the two police officers that came to the domestic violence scene?
Yes.
You're like the big angry guy cutting on the poor little victim. There's a lot of anger behind that. All that unresolved anger, you've sort of done it around the side door and boom, back on yourself. And you have to believe that you're bad. You have to believe that it's very sensible and reasonable to mutilate you, and yet you don't deserve better treatment.
My father used to burn me with cigarettes.
So that got ingrained in your head over and over and over and over and over.
Well, I don't act like my father.
Well, you are acting like your father when you do exactly the same thing to yourself that he did to you. That's copying your father's behavior and attitude towards you.
I'm not like my father.
Well, but
I loved my mother. I'm not like my father.
the fact, you're not like your father in general. But when you treat yourself abusively, you're treating yourself the way your dad treated you. So you're being like your dad in that sliver of life, not overall in general. But in that behavior, you're exactly like your dad.
Well, I hate that. Quit saying that.
Well, actually, I'm glad that you hate it because I'm hoping that'll be a motivator for you to stop the behavior of self-mutilation. And I think that you're mutilating.
That makes me hate myself more because I hate my dad.
Okay, so you hate it when I say that you're like your father?
Yes.
Okay. Help clarify a couple points for me. What's your father's name?
Bill?
Is that your name?
No.
Is your father male or female? Is your father 28 years old?
I know I'm not my father,
Okay.
but you're making me sound like my father.
Well, because I think in that narrow aspect of your behavior towards yourself, self-mutilation, you are behaving like your father. That doesn't make you your father. You didn't just turn into
I don't want to behave like my father.
If you don't want to behave like your father, I think it then is true that you must and you have to stop the self-mutilation and the self-abuse. And I think there's several levels of quote, self-mutilation that you do.
But you don't understand. There's a lot of different things that happen when you cut yourself.
Mm-hmm.
And it's not just about making the feelings go away. I mean, that's part of it.
What
but
else?
I need to see the blood that comes up.
What does that do for you?
It makes me feel better. It makes me feel more real. I don't know, I feel more connected. I know you're not going to understand this because you haven't ever done it, but I need to see it. And I've been struggling more lately, and it's like the more I struggle, the more I need to see it, and that's why the cuts have been so deep, is because I want to see more blood.
I don't understand it in the sense that I've never been inside your experience and experienced your reality. But here's what I do understand. And it's not really that hard to understand. You're telling me that you need to see the blood because the blood does something additional for you, which is it makes you grounded, makes you feel solid, makes you feel real. Connected. So one of the bad feelings that you have is not feeling connected.
Right.
So just the cutting doesn't help make that particular bad feeling go away. What makes that particular bad feeling go away is seeing the blood, which then reconnects you. You're solid, you're grounded, you're real, you're in your body.
Does anybody else ever tell you stuff like this?
Actually, in fact, many, many people have.
Other people want to see the blood.
Yeah, that's not the least bit unusual. It's a very common aspect of self-mutilation. And that's sort of good news because that means it's not just strange or incomprehensible or you're the only person on the planet doing it. And it actually makes you a member of the human race who has a self-destructive habit. And I think this is like an addiction. This is why your therapist talks about it being
yeah,
addiction.
now you sound like him.
Well, remember I said we'd come back to that. And addictions, there's all kinds of attitudes towards addictions, but what's the basic purpose of an addiction? From my perspective, it's very simple. Simple to understand. Where you are right now is here. I'm talking in general. Here is intolerable because of this feeling or that feeling, this conflict, that problem. So here is just intolerable and overwhelming. So the purpose of the addiction is to take you from here to over there. Over there is stoned, high, wasted, thrilled, distracted, passed out. It's somewhere else away from the intolerable bad feelings. So every addictive behavior has the purpose of taking you from here to over there.
Well, I had an eating disorder in high school.
And just looking right in the eating disorder behavior, short term, what was its purpose? What did it do for you? Might be hard to remember now, but.
Well, I mean, I know it was about when I was feeling like I didn't have any control and was feeling overwhelmed.
So it gave you a sense of, at least I can control my food intake, my body weight.
Yeah, but my dad also told me I was fat all the time, so.
Right, so that reinforced it. But when you did your eating disorder behavior, then did you feel, at least here's this area of my life?
Yeah, it was the same kind of thing, I guess. I mean, now that I think about it, it was, yeah, I guess did kind of the same thing for me.
So my point about, I'm not hung up on the word addictions as such, but we use the word addictions normally to talk about drugs and alcohol. Now the word addictions is kind of spread out to gambling addictions and sex addictions and Love Anonymous, this, that, and the other. But I think if you expand the word addictions, it covers almost all self-destructive, self-abusive behaviors because they all serve the common purpose of give you that sense of power and control, get rid of the bad feelings and the bad conflicts and the bad reality, and make everything be okay temporarily.
Can you be addicted to, like, reading?
I'd say there's almost no limit. You could be addicted to anything. Is reading a bad thing in and of itself? No, reading's a wonderful thing. But if you hide from life and spend 14 hours every day reading, or you spend 14 hours on the internet, or you spend 14 hours drunk, you spend 14 hours at the casino gambling.
I read a lot.
Well, I'd have to ask more questions. You might just be a voracious reader, and that might be good. Or you might be...
It's an escape. Because I read fiction books, and I try to escape into them.
That's what fiction's for, in part. It's just a question of balance. Reading in and of itself is a normal, healthy thing. We don't talk to people with eating disorders and then say, well, eating's a bad thing, we should get rid of eating. Everybody would starve to death and die. We don't say to somebody...
The anorexic is like that.
Yeah, but it's not a healthy goal for everybody on the planet to stop eating. It's not a healthy goal for everybody on the planet to stop reading, stop having sex,
or stop cutting.
Having a glass of wine. Well, cutting's a little different now because cutting actually destroys and damages your skin. And cutting is not a normal pastime that's just something that people do.
But the scars don't bother me. I mean, they gross other people out. But, I mean, as weird as it may sound, I kind of like them.
I forget if you told me or I read in your materials that your therapist sent over, you had a breakup of a fairly long-term relationship just, I think, like 3, 4, 5, 6 months ago, something like that?
3 months ago?
3 months ago, which is around the time that the self-mutilation escalated?
Yes.
Did you self-mutilate some prior to 3 months ago, like between 3 months and 12 months ago?
Yeah, but not this bad.
How did your boyfriend like it when you self-mutilated?
He hated it. He didn't understand.
Right. So do you think that your self-mutilation brought the two of you closer together?
See, this is another thing that proves that it's my fault and I'm bad because he left because I was bad.
Okay, hold that thought for a second. But it is a fact, you agree, that your self-mutilation contributed to the failure of the relationship and pushed him away.
He said he couldn't handle it anymore.
Okay, and he's probably being honest, and that was probably just true, right?
Yeah, it's true that it's my fault.
Okay. Well, before your fault, I want to get to, it is true that, in fact, the self-mutilation drove him away and contributed to the end of the relationship. You're agreeing that that's a fact? That seems like a reasonable assessment? I'm sure there's a whole bunch of other stuff about the relationship, but that was a fairly important factor that drove him away. Is that true?
Yeah.
Okay. So that's just a fact of life. And now we're getting into the cost-benefit analysis side of things. So the cutting, we've clearly established the benefit. Gives you a sense of power and control, makes you feel connected, bad feelings are gone, positive feelings come in their place, now we're starting to look at the downside, some of the cost. And it's just common sense. You don't have to have any degrees to figure out that self-mutilation drives other people away. It's very, very painful to love somebody and be close to somebody who's cutting on their skin.
You should love someone for what's inside, not what their outside looks like, or if they have scars, or...
That's true, but in practical reality, it's very, 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 very hard to take being intimate with somebody who's harming themselves actively in that way. It's just, human beings just aren't tough enough to deal with it. It's hard thing to deal with. It tends to drive people away.
So that proves I'm bad.
That could be one conclusion we could go to. But right now we're just trying to agree on the facts that it does drive people away. It's simply the behavior. In the ideal world, the person's going to stay with you and love you for what's on the inside. But in practical reality, it has the effect of driving people away.
Well, I just couldn't prove to him. He wouldn't believe me when I said I didn't feel it and it didn't hurt.
Right, well, that's because he probably doesn't grasp the reality of dissociation. Most people can't grasp that you can actually block out physical pain to that degree.
Right, so if I could have just convinced him of that, he probably would have stayed.
I don't think so. I think it still would have been profoundly upsetting and disturbing to him and still would have created a big gap between you and him. By the way, we know scientifically from hypnosis research and acupuncture that it's possible to undergo pretty serious surgery without any chemical anesthesia at all, just with hypnosis or just with acupuncture, and have no pain whatsoever. So this is not just some hokey theory. This is an absolutely known scientific fact. A person can have major surgery going on, their pulse is normal, blood pressure is normal, they report that they feel no pain, they're not sweating, they don't look agitated. So there's no reason to doubt that you, in fact, can block out that pain entirely.
Well, I wish you would have talked to him.
Well, but if I was talking to him, I would have said to him, but nevertheless, I would expect that trying to be in a relationship with a woman who's self-mutilating is very, very difficult and maybe for you impossible. And to me, that's a normal human reaction. It's hard to take and hard to deal with. But you told me something interesting. He should, people in general, him in particular, should love you for what's on the inside. That's a statement you made. You agree with?
Yeah, I just said that.
Okay. Why shouldn't you love you for what's on the inside?
That was very sneaky.
Mm-hmm. Well, I'm a sneaky guy, so. Don't you? If you deserve to be treated decently by him, wouldn't it be true that you should deserve to be treated decently by yourself?
But I don't always see the good things in myself, and he had a better time seeing the good things in me than I did. He was able to see them.
Right. Well, that's something you could work on.
Well, that's hard to do, 28 years of not doing that. It's hard to just stop it.
The kind of therapy work that I believe that you need to do is very intense, very painful, and very difficult, but it has an outcome that's worth the effort. And the outcome is you can get on track with your life goals, which is finish your master's, maybe do the PhD, go into the counseling field, get involved in relationships, have a family. But it's hard to get there if you got all your energy wrapped up in self-hatred, self-blame, self-mutilation, and all the energy that's required to try and control and contain and do something about these intolerable feelings. That just drains so much away from trying to be on track in life.
I don't know what to do with these feelings when they come up, though.
Let me just hold that for a second. I want to say a couple of things, and then I will comment on that. If you start working on loving yourself the way your mom loved you, the way your boyfriend, imperfect as he might have been, loved you and tried to love you, if you work on loving yourself in that same way, then it's really going to start to sink in that you never were bad, you never didn't deserve all the verbal abuse, and you said he slapped and hit you too? Your dad?
He burned you with cigarettes.
Burned you with cigarettes. A lot of physical abuse, a lot of emotional abuse, a lot of emotional neglect. You never caused that. You never deserved it. You didn't cause or deserve your mom's death. It was just an unexplainable tragedy that happened. If that really sinks in and you really get that, which you will if you start doing more positive self-talk, treating yourself better, not mutilating yourself, not blaming yourself, that'll go along with, I know that I was good and innocent and I deserve to have my mom alive for the rest of my life. I deserved a decent dad. I deserved all these things. When that really, really starts to sink in, then you will know that you don't deserve to be self-mutilated. you will not be able to cut on yourself when you really get it, that you deserve better treatment. Then you'll have to say no to, quotes, your drug. It's just like saying, just say no to drugs. Easy to say, not so easy to do. Just say no to alcohol, just say no to cocaine. In your case, just say no to self-mutilation.
And you're saying self-blame too.
And self-blame, which is another, it's like a cognitive or mental self-mutilation when you're doing all that negative self-talk and blame all the time. It's a very...
I say all the things in my own head that my father said to me. I call myself all those names that he called me.
Exactly what I was going to say. So that was mean and cruel when your dad did it to you when you were 8, and you didn't deserve it then. And it's mean and cruel of you to do it to yourself now.
And you think that's why I can't finish school and I can't have a relationship? And
yeah, I think these things are all tied together because it's very hard to be intimate and close with somebody who hates themselves.
But this was so long ago.
It sometimes takes a long time. Especially when it happens when you're so young and you don't have good, healthy, normal supports. You don't have healthy role modeling. Nobody's showing you normal, healthy grief. Nobody's showing you how to handle their feelings in a mature way. How is your dad dealing with his loss and grief? He was dumping all his anger on you. What kind of healthy role modeling was that? So you didn't
I learned to blame myself.
You learned through role modeling not to handle your feelings in a healthy way. You learned through, quotes, brainwashing. He told you were bad and wrong. And then it got ingrained, and it really worked for you because that locus of control shift gives you that sense of power, control, and hope. You can prevent more tragedy in the future. So it was reinforced by your dad, by what he actually said, by his modeling for you, by the absence of any other healthy adults and caretakers to show you a different way. It was reinforced by your own thinking, and it was reinforced by the payoff of the locus of control shift. The focus is on self-mutilating right now because that's, quotes, the problem. That's not the problem. If you just say no to self-mutilation, remember we started off with it's under your control, it's conscious, it's
right.
A decision, it's planned. So you can, in fact, decide to stop. If you do, you will begin to feel better about yourself.
No, I feel overwhelmed just thinking about it.
Yeah, but I'm just taking the guess that if you really say no to your addiction, despite the overwhelming feelings that are going to come up, you're going to feel proud.
But
and you're going to feel good about yourself.
Wait a minute. What do I do with the overwhelming feelings that come up?
Now, that's a very good question. And I assume that you're afraid you're going to go back to self-mutilation.
I know I will. I know. Okay. I mean, just talking with you hadn't solved all this. It's health, but I know I'll cut.
I don't expect it to. And looking at the frequency that you've been self-mutilating over the last 3 months, I don't think it's realistic to do this work on an outpatient basis right now. You need to come into the hospital. I'm talking for a couple of weeks. Have a really intense piece of work that you get done. There's like 35 hours a week a group. There's 3 hours a week of individual therapy. There's visits from a psychiatrist, visits from your outpatient therapist who will come into the program. There's the safety and structure of containment of the program so that you can really say no to the self-mutilation. And when the feelings are overwhelming, you got a lot of support there. There's going to be a lot of teaching, a lot of learning, and you can build up a whole repertoire of things to do that you just couldn't get done in 2 weeks on an outpatient basis. And without trying to explain the whole thing in every single detail, we do have a whole lot of techniques and strategies, skills, building support systems, self-soothing techniques that we can teach you that you can practice. And you can practice this systematic desensitization, going even more fully into the feelings, which we know is not going to be hard because when you stop the self-mutilation, they're going to come up. Equally, how to back out of the feelings, soothe yourself, calm yourself down, back into them again.
It sounds really scary.
It's very scary and difficult, and that's why I think you need to be an inpatient. And the fact that you've been self-mutilating so much, I think, is a measure of how scary and overwhelming it is to you.
And it's getting worse.
Right, and so we want to interrupt that cycle now. And that's why we have this inpatient program. The number one reason why people come in to an inpatient setting is their self-destructive behavior is just too far out of control, and we need to put the brakes on. And we need to help the person develop a whole set of other strategies so that post-discharge, you don't go back into the same pattern.
Well, school's out for this session right now. I have a few weeks before I have to go back.
Good, so that's a handy opportunity then. So remember, we're going to keep in mind every step of the way over the next few weeks that the problem is not the problem. But never, at the same time, we're focused on self-mutilation. We do want you to be able to drop that behavior and have more healthy skills, more healthy strategies post-discharge. In order to get there, we're going to have to deal with all this unresolved, overwhelming grief and sadness and loss and self-blame. That whole ball of wax that we've been talking about. That makes sense to you?
Yeah. Does everybody there understand it like this?
Yeah, we have a whole program staff that understands this model, that's been working in it, gets it, applies it.
Can I maybe leave earlier than 2 weeks?
Yeah, it's totally negotiable and flexible. If you're really stable, you've learned a lot, you're ready to go in less than 2 weeks, great. And we very rarely do people stay much longer than 2 weeks.
I don't really want to stay that long.
Good, so that's perfect. If you're able to go in 5 days, 7 days, 9 days, fantastic. So I'm assuming that you're agreeing that this is a good idea, good plan.
Well, it's really scary to me, and I want you to talk to my therapist.
Absolutely. I'll do that. Actually, right now I can give him a call. So I can tell basically by your facial expression that you're saying yes to me.
I want to call my therapist and talk to him, but I don't know what else to do.
Okay. We can actually put him on speakerphone here if you want and talk to him together if he's available.
Okay, if it'll work.
Okay. I'm very glad that you came down today. I'm glad I had a chance to meet you. Let's see if we can get your therapist on the phone.
Okay.
Great. To summarize then, the elements of trauma therapy that you heard in the role play were the locus of control shift, the problem is not the problem, the attachment to the perpetrator, which was dotted throughout, the addictions component of the model, the basic idea that avoidance is what it all boils down to, avoidance of intolerable feelings and conflict, and then the several different pathways to self-mutilation. In conclusion, I just want to tell you briefly about our Visiting Professionals program and our website. The website address, which is also on the back of the CD, is www.rossinst.com. There's a lot of information there about all kinds of different things related to trauma and its treatment. There's also information about the Visiting Professionals program, and there's contact phone numbers on the CD cover as well. The Visiting Professionals program basically is an arrangement whereby professionals can come for half a day, a couple days, even a week or two, sit in on groups, sit in on team meetings, and really get a hands-on experience with how this all works, and then take those skills and principles back for application in private practice or whatever setting you're in. Thanks very much for listening.